we're going to be performing a Kybella treatment. And Kybella is the first FDA-approved non-surgical treatment for fullness in the neck area. As we age, we get fullness in the neck, and even at a young age like this patient, sometimes we just have a little central area of excess fatty tissue here. Now that can be addressed surgically with either liposuction or directly removing the fat. However, a lot of people opt not to have surgery due to the downtime and the restrictions after surgery. And that's why Kybella is so exciting, because this offers patients something to address submental fullness without having to undergo surgery. So Kybella is a substance that we inject underneath the skin, and it actually dissolves the fat cells. So here we have marked out our boundaries, and we're going to inject in the central area here. So we mark out the nasolabial fold and follow that line down here, again on the other side there. We mark out the inferior edge of her jawbone. There are some nerves in here that we want to avoid, so we mark a second line underneath that. And then we find the Adam's apple area here and go just above that. So this area right in here is where we're going to inject the product. So here's the grid that we're going to use in order to keep track of all the injection sites. This is basically just a little temporary tattoo like you've seen children have. We're going to apply this to the skin, and then we're going to use each dot as a point of reference to inject the product. Now you'll notice they're different colors. The only reason they're color coded is so that the injector can keep track of where they left off, because there's several injections involved. So here we're cleaning off the skin with a surgical soap solution. Anytime you perform injections, whether it Kybella, Botox, or filler, we always want to clean the skin and sterilize it so that you don't get any infections. Okay, next we're going to apply the grid, and we just moisten the tattoo, hold it with a wet gauze. Now we're going to pull the backing away, and you can see all those little tiny dots, and those are going to be used as a point of reference for our injection sites. Alright, so we're going to start the injections, and we just use the smallest needle available. It's the same one that we use for Botox treatments. And we just inject a very small aliquot of fluid right underneath the skin surface. You can see that we're purposely going on the side of the dot. You don't want to go right into the dot, because you don't want to drag any of that color from the dot into the skin. So we continue all the way across the grid so that every dot is addressed. And this actually starts dissolving the fat instantaneously. So after the treatment, we just simply use a little acetone to remove all the markings. Like I said, there's very little downtime with this. You do get a little swelling because you are dissolving the fat. We actually recommend to avoid any kind of ibuprofen or anti-inflammatories, because we want that inflammation to help break the fat pads down. Then we just apply an ice pack, and the patient can apply ice off and on for the rest of the day. They're restricted from holding off on any type of exercise or heavy hiking or running for the rest of the day, but starting the following day they can go back to their normal exercise regimen. If they have a lot of swelling, occasionally we'll give a patient a little chin strap, which is a little Velcro wrap they can wear off and on to help compress some of the swelling. So we're done now. So typically we'll have the patient come back in a few days just to double check and ensure they're doing well. And then we see them back in 4 to 6 weeks to evaluate if they're a good candidate for another treatment. So how did that feel? Any discomfort? Usually it's very well tolerated.
Yeah, it was pretty easy. I mean, you feel a little bit of the pinprick from the needle, and the solution kind of burns and stings a little bit, but the ice really helps afterwards.